Okay, your name, sir?
Derek Cooper.
Now, Derek, why are you down here tonight protesting Care First, which I understand is Blue Cross Blue Shield of Maryland now? Why are you doing that?
Well, because I don't have insurance. I had, through the state of Maryland, I had Maryland Health Insurance Plan as my insurance, and Maryland Health Insurance Plan was transitioned to Blue Cross Blue Shield. In the process, nobody figured out how to make the transition happen, and so when I went to pay, I was not told where to send a check. In fact, what I was told was to send a check to both companies, Maryland Physicians Care and Blue Cross Blue Shield, and it would all get sorted out. Of course, I was already bankrupt. I had just refinanced, paid out $80,000 in medical expenses to pay my debtors. Refinanced my home. And I was in the process of doing that. I was waiting for that money to come through, and in order to pay my bills, I didn't have enough money to pay the insurance, but I would have been able to get enough to pay one of them. They cut off my insurance. I was left without insurance. I have a chronic disease. If it's not treated, I'll die. My insurance was paying for very expensive treatment. At the time I was taking Remicade. Remicade is about $9,000 a dose. I paid for 2 doses of that. In total, my expenses right now, having taken out a home equity and paid off my existing debt, I currently owe another $36,000. I don't have insurance, and I have no way to get treatment. So I'm here hoping that we can get this system fixed. I didn't ask to get sick. I don't want to be sick. I want to continue working. I do work, and part of the reason that I can't get the state to just pay for everything is because I'm not on Social Security. If I were on Social Security, I would have more benefits, but then I would have no future. And I don't want that.
How old are you, Derek?
34.
And what your medical expenses, how much did they add up to? Can you say that? Or?
I currently owe $36,000 in direct medical debt.
What's the remedy for somebody like yourself? What is it you want the government to do?
Well, I'd like to have the state of Maryland sort out my situation. They have refused. I was told by the director of the Maryland Health Insurance Plan that if they were to fix my problem, they would have to fix everybody's problem, and then they wouldn't be able to run the program. And I don't get that. Why the state figures that I should just die. That is quite honestly what would happen if I didn't get treatment. I've been fortunate that Abbott Labs makes Humira has given me the treatment for free, and that's keeping me alive. But it does not pay for lab tests that I need ongoing. My last lab tests were $800. It doesn't pay for me to see my doctor. It doesn't pay for the last time I needed x-rays, chest x-rays, to rule out the possibility that I might have had tuberculosis. I had to pay that out of pocket. Fortunately, I didn't have tuberculosis. I want the state to do their part to fix my situation, but I also think that this system needs to be fixed from the ground up. And if that means putting the insurance companies out of business, what these people are doing is criminal. It costs people's lives. If I didn't have the ability to have gotten as far as I would, barring my having done what I've done, I would be dead. And it's not right. And there are people who are dying.
Okay. Well, thanks so much, Derek. Appreciate it.